my name is Caroline Houston, and this is my final presentation on cardiovascular disease and lifestyle factors. On this slide, I provided some background on cardiovascular disease. So this disease affects the heart and the blood vessels, and someone with cardiovascular disease could experience symptoms, which means they're symptomatic, or may not experience symptoms, which means they're asymptomatic. It is also the leading cause of death in the United States and around the world, and it also affects people of any age, sex, race, and socioeconomic status. As for biology, there are several different cardiovascular disease. Some are known as arrhythmia, coronary artery disease, peripheral artery disease, and cerebrovascular disease. The causes of cardiovascular disease varies on the specific type. Some can be caused by plaque buildup in arteries, genetics, medications, abnormal heart rhythms, blockages in blood vessels, high blood sugar or high cholesterol, limited physical activity, and poor diet with processed foods that are high in saturated fats, trans fats, sugar, and sodium can lead to hypertension and then can lead to cardiovascular disease. Smoking also increases heart rate and blood pressure, which also increases the risk of heart disease. As for my epidemiology slide, the risk factors for cardiovascular disease include high blood pressure, which is also known as hypertension, high cholesterol, use of tobacco, type 2 diabetes, obesity, lack of physical activity, alcohol, diet that is high in sodium, sugar, and fat. Economic, social, environmental, and psychological factors also all play a role in the development and access to care for cardiovascular disease. And women are also tend to come across more barriers to have access. So barriers for cardiovascular health starts with women having limited access to maternity leave as well as access to effective contraception. Low-income individuals and families can also experience limited social support, reduced access and affordability for healthcare, which can overall make it difficult to access practitioners, specialists, treatments, and medication when it comes to cardiovascular disease. Right, as the socio-ecological model implications, cardiovascular disease can create an economic burden on an individual, family, and community. Training healthcare workers on how to educate and promote cardiovascular health at a family level can be beneficial to lower risk factors, but also lower costs that are related to cardiovascular disease. Accessibility to prevention programs can provide education and improve access to resources like checking blood sugar, cholesterol, and diabetes. It can also help to promote healthy lifestyles, examples of diets and exercise to implement into people's daily lives, as well as providing these services in multiple different places like in a work setting, school, church, and parks in order to reach a variety of different communities. And that will also help to reduce the barrier of education and knowledge of different resources to different communities. I talked about a program and an intervention that relates to cardiovascular disease and lifestyle. So the first one is the Dietary Patterns Method project, which helps to modify diets to limit the risk of cardiovascular disease. And this talks about how rich in fruits, vegetables, legumes, whole foods, and lean protein sources, as well as the Mediterranean and DASH diet, have positive effects on the microbiome and can improve cardiometabolic risk factors. They also use data from 3 large cohorts of U.S. adults and found an increase from 14 to 28% of an increase of lowering the cardiovascular disease mortality rate. And then the next one I chose was a program that's called Million Hearts, which focuses on improving cardiovascular health for all, focuses on populations that are experiencing inequalities, and focuses on improving strategies for healthy communities. Also, to improve blood pressure control, increase physical activity, and increase use of cardiac rehabilitation, as well as focusing on health equity within communities like people with lower incomes, people who live in rural areas, and racial or ethnic minority groups, and has the overall focus of achieving health equity within these communities. Right, my overall conclusion and takeaways between the relationship of cardiovascular disease and lifestyle is that you can reduce the risk of cardiovascular disease by eating more fruits, vegetables, less foods with less sodiums, and whole grains. And another important factor to reduce the risk is exercise and not smoking. It is also important to recognize different communities that aren't provided the resource and education on cardiovascular disease, and what steps are important to take in order to reduce the risk of cardiovascular disease within these communities, whether that's education or providing resources for these communities. Thank you for your time. This was my presentation, and here are my resources. Thank you.